guys, welcome back to Empowerin'. I'm Caroline Porter Thomas. Thank you so much for watching. So over the years, I've gotten a bunch of requests to do a What's in My Nursing Bag video. So that's what I'm going to do for you today. To start, I carry a lot of things with me because I don't know if you know, but I am an agency nurse. So I travel from hospital to hospital and unit to unit. So a lot of times I just have no idea what I'm walking into, so I like to be prepared for everything. If you work on the same unit every day, then it may not be necessary to carry everything that I carry, but just like I said, I need to be prepared for whatever because I never know what I'm walking into. Let's get started. The first thing that I want to show you is this bag, and is Eddie Bauer, and I can't believe that I'm going to share with you this next thing that I'm going to share with you, but this is actually a diaper bag. But what I was looking for was I needed something really strong. I actually broke my last two nursing bags, so I wanted something that was super durable. So I looked for a really strong strap and something that was going to be also comfortable. Now you do not have to get a diaper bag, but you just want something that's going to be really strong because I feel like this bag starts accumulating all kinds of things and just seems to get heavier and heavier. But let's just start going in it. So the first thing that I have here is my folder, and I try to get a really thin folder because the only thing that I really use this folder for is I put my patient's report sheet, or in the hospital that we call cardexes. So I just put it here and then I can cover it, and that way it's, you know, hiding my patient's information. I also put my name really big on it so that people can know not to look into it, that it's my property. So I hope people don't look into it. The next thing that I have is my planner, my 2014 planner. I carry this with me everywhere I go. A lot of times when I'm working on a unit, they'll ask me to come back so I can see if I'm available that day. So it's kind of important for me to always have my planner with me. Also, when I used to work full-time on a unit, there's always nurses that are constantly asking, hey, can you switch with me for this day? Can you switch with me that day? So it's probably really important to have your planner with you. We're gonna go on the side here. So I have gum. I always have gum with me just in case, and you never know when you have a close talker. So you wanna make sure your breath smells pretty good. And then I always have chapstick with me. I love this chapstick. Over here, oh, I have shoe polish, just in case. I don't know why I have this in my bag. I don't know, but just in case something happens at work and I need to polish my shoes. This right here, I usually have a lotion or two with me just in case I need to smell a little bit better. I do like this one. This is the Orange Ginger Energizing Lotion, and just in case I need to smell a little fresher. I don't know, I haven't used this in a long time. This can probably go out anyways, because you're not supposed to use your own lotions anyways because it can break down the gloves or whatever, but that's just in case I need to smell a little bit better. It's not really for my hands. I do have my name badge, and I also have this really cute little name badge holder. So I love this thing. This is what really makes my bag heavy. I always carry this with me, and it's really important for me to stay hydrated throughout the day. A lot of times I'll feel really tired, and what I know is that a lot of times the feeling of fatigue comes from dehydration. So having a lot of water with you is really important. This is empty right now, that's why I'm like able to, you know, just kind of like throw it around. But because I do refill these, I usually buy one a week, and that will last me the whole week. So this is my temporal thermometer. I know I talk about it in my second book. It's really important that I do have this with me because sometimes thermometers can be hard to find, and I need to know what my patient's temperature is. Nowadays you can buy them, they're much smaller and they're much cheaper. I'm kind of just waiting for this one to break, and then I'll just invest in a new one. Oh, I have your brush. I don't really use this that much. When I'm at work, I usually just keep my hair up. It's just easier. These two items are really important. This is a pulse oximeter. So you just put your patient's finger in there and you turn it on, and you can know what their heart rate and oxygen saturation is. I think this is very important for every single nurse to have, because if your patient is short of breath, instead of running around trying to find a machine, you can just put this on their finger and you know right away if you need to be worried or not. So this saves me a lot of time and a lot of headache. I think it's really important for every nurse to have. I got this one at CVS. It just says pulse oximeter on it. I'm not sure what the brand is. Oh, it says Model OxyWatch. I don't know. But this is what it looks like. But they have a lot of them, and I think that they're, just like technology always does, I think they're getting cheaper and cheaper. I remember spending about $50 to $60 for this, and I think lately I've seen them for $30. Also, it's really important to have a pen light. When you need to do a neuro check, it's really important that you're able to put the light in your patient's eye to make sure that their pupils are equal and reactive. Oh, I just have a little mirror. Just make sure I look okay. Oh, toothbrush and toothpaste. I'm like obsessed with brushing my teeth. That's just me. Oh, this is just something that I do. I have this like fear of not having what I need with me. I don't know why. But if I do need an ibuprofen, like if I have a really bad headache or whatever, or sometimes I get these sinus infections that can be really bad, and so I always have a Mucinex with me and Advil tablets. And what I find is most of the time if I feel a headache or if I feel like a cold coming on, I can just drink some water and I usually feel fine. But having that extra backup just helps me relax, just in case I absolutely have to have it. Because guys, you are there for 12 hours, and those 12 hours you may not have time to take care of yourself the best way that you should. So, you know, it just helps me feel a little bit more relaxed and better. Obviously, I always have a stethoscope. Actually, this model I really do like. This is the Prestige Medical, the lightweight version, and I've really been liking this one. I've been able to keep it around my neck and kind of forget about it because it is lightweight, and I've been able to hear really well, so I have been liking this one a lot lately. So if you guys are looking for a stethoscope that's reasonably priced, then you might want to look into this one. Okay, this bag is I should have probably cleaned this out before I did this, but let me just show you the highlights. So I have alcohol swabs, lots of them. I think this is really important to have gauze with you because a lot of times your patients will have just little areas that are bleeding, and you know, if you have gauze with you, then you'll be able to just whip it out of your pocket and stop the bleeding. Here is medical tape. I always have medical tape in my pocket. It's really important. You'll use it a lot. Oh, sticky notes. So just so you can see a little bit of my obsession with sticky notes. Flushes, really, really important to always have flushes with you because you'll use tons of flushes. Oh, Sharpies. Sharpies are really, really important too because a lot of times you'll have to label things on plastic. I also have my dry erase marker so that I can update my patient's board, especially with my name and phone number first thing in the morning, my name, phone number, and date, and then as the day goes on, sometimes I'm able to update their plan of care. I do have scissors, medical scissors. These are really important to have with you, and it's really important to have medical scissors because they have that like blunt end. You can actually go next to your patient's skin, and just make sure you clean these off really good between. Oh, these are my scissors that I only use for wound care because after them I sterilize them and I let them dry in a place by itself. But I always have 2 pairs of scissors with me. Another thing that I have is telemetry calipers. I think it's really important to have these with you when you are reading the EKG strips. You know, sometimes you may have a question. These calipers can tell you a lot because when you're comparing each beat to each beat, these really come in handy. So I recommend if you're a telemetry nurse or an ICU nurse to have a set of calipers handy. I love these. These are ballpoint pens, but they're different colors. And so here I have turquoise, I have black, and I have green, and I have 2 turquoise. That's why I have 4. So I like these a lot because they help me stay focused on things that are really important that I might forget. Like, you know, 24-hour urines are something that it's not like an emergency, but you need to make sure it's finished on time. So I might write end 24-hour urine at 2 o'clock. And I'll write that in that color just so I remember that. I have tons of mechanical pencils. I am obsessed with mechanical pencils because you can erase pencils. So if I write something and, you know, then later I decide it's not a big deal and I don't need to pass that on in report, then I can erase it. And that's what I love mechanical pencils for, is because you can feel free to write whatever you need because you have the flexibility of erasing it later. I do have a highlighter. I honestly don't use it that much, but if I do feel like I need to highlight something, it's there. Whew. The rest of these is just like tons of pens. I think I'm like a pen kleptomaniac, so somehow they always like fill up here. And then sometimes I'll just like empty them all into the report room and everybody can grab whatever they want. So I also have a battery with me. I don't know how it's got in there actually, but This is one of the batteries that we use for the heart monitors. And so, you know, a lot of times you'll get a call from the telemetry technician that says you need a new battery here, so it's always good to have one or two with you. And these are the telemetry leads that we use. So I have a few with me just so if one lead needs to be changed, I can change it. Oh yeah, this last section, I honestly don't go here that often, but there's more sticky notes. I do carry with me filtered needles because a lot of times we have to open glass vials, and for some reason filtered needles can be hard to find on different units. So like I said, because I travel from unit to unit, I really never know what I'm walking into, so I just like to be prepared to give the best care that I can. And here I have more alcohol and more flushes. Alright guys, I hope you enjoyed this video. If you did, please give it a thumbs up and let me know what other videos you want to see next. Alright, I can't wait to see you next week. I love you. Bye.